This week on Informed Consent with Dr. Joseph Morris.
When you meet one person who has Alzheimer's disease, you've met only that person, meaning the disease, even though it has a name, is individualized. And these people come to us with a past, and their past is often what they're functioning off of because they're losing the memory of current things that are going on.
Hello, everyone. This is Dr. Morris. Join me on the next edition of Informed Consent as I interview Dr. Angela Allen, researcher, registered nurse, and rehabilitation specialist, as she focuses on Alzheimer's amongst African Americans and Hispanics. You don't want to miss this.
Thank you for listening to the radio podcast Informed Consent with Dr. Joe Morris, reminding you to live well, laugh often, and enjoy life.
Informed Consent.
Hello, everyone. This is Dr. Morris, and welcome to another edition of Informed Consent. And today we have another important topic. We're going to be talking about the issue of Alzheimer's disease. And today I brought up a very special person on the show, none other than Dr. Angela Allen. And let me give you just a brief synopsis of her background. She has a Doctor of Philosophy degree, a PhD from Arizona State University College of Nursing and Health Science Innovation. She has a master's in education. She also has a master's in arts and teaching and a bachelor's of science in nursing. She is also a certified rehabilitation registered nurse with a specialization in research that focuses on Alzheimer's disease. So with no further ado, I'd like to welcome Dr. Angela Allen to the show.
Thank you very much, Dr. Morris.
Yes, and thank you for being on the show here. Well, today we're going to be talking about Alzheimer's disease. And this disease, as we know, not only impacts people all over the world, but we also know that it has a disproportionate impact on persons of color. So I want to start off by talking about what is Alzheimer's disease, and if you can give us a little background on its prevalence. Now, I know that, especially in the urban community, at least where I grew up at, we have all types of names that we call it: old timers, some timers, senile. But can you set the record straight for us and just give us a little background about it?
Absolutely. Thank you, Dr. Morris. And yes, you are right. We call it different names. There are so many different names that have been mentioned. As you've stated, the Alzheimer's, and again, it's obviously an innocent mistake because it's very similar to the term Alzheimer's. And by the way, Alzheimer's, which is actually the name of the scientist that actually discovered the disease, is a German scientist in 1906. Some say in 1908, Alois E. Alzheimer's, who actually discovered the Alzheimer's disease, was actually identifying a person who had certain characteristics. Before I move into the term Alzheimer's disease, I'd like to share with you that there's another name people call it, and it is dementia. It is actually a term that's used interchangeably with dementia and Alzheimer's, and it is because of the fact that it is a certain type of dementia. Now, before I go into Alzheimer's, I can also share with the audience that dementia is not a specific disease. It's just a term that categorizes certain things that we identify with a person who has memory issues or brain issues, such as having an issue of remembering, thinking, or making decisions that may interfere in what they do every day. There are 100 different types of dementias, and the most common one is Alzheimer's. About 60 to 80% of the people who have been diagnosed with a dementia is typically identified as having Alzheimer's.
So,
Now,
Dr. Allen, if I may interrupt, so for the layman people who are listening, so if I say my mother, my grandmother, my loved one has dementia, as you mentioned, there's 100 types. I should be more specific and clarifying with saying what type of dementia, right? That's what you're saying.
Absolutely, Dr. Morris. And I think there are people who have said, even in the doctor's office, the doctors have even shared with the family members that your loved one has dementia. And I agree with you. Often we have to be more specific, we as healthcare professionals and also the layperson, caregivers, by asking the doctors, physicians or any type of providers, well, what type of dementia does my loved one have? And again, usually they may say Alzheimer's, or they've even said Parkinson's, which is a former type of a dementia. And there are others, but Alzheimer's is the most common one that they would typically say in the doctor's office.
Now, is the disease contagious? And how do you get it?
Now that's a good question. I've been hearing that actually lately since we had the coronavirus going on. So it is not a contagious disease. It is a disease that, and there have been people, as I've shared, that have stated that it could have been contagious from any type of general or intimate physical contact, or even airborne, but it isn't. It is, according to scientists, and I'll make it a little bit more generic, it is a disease that is often found in the brain, and it could be related to either certain things that occur in that person's lifestyle and their family history. So it's not contagious where you can get it from one person to another, but typically it is seen whereas an individual like myself, my family has a long history of Alzheimer's disease, particularly Alzheimer's disease. So therefore, I would have a concern by thinking, would that be something that I would actually get because of my grandmother and my great aunts having it as well?
Now, I recently read that there are different stages of the disease, and that people who get the disease, they progress through the different stages. Can you talk about that a little bit?
Absolutely. So you are correct. There are different stages of the disease. Some have stated that there is five, which one is called mild cognitive impairment, but that isn't a dementia. It's just some people having problems remembering things, and they find ways in which they can actually remember how to adjust or address the concerns. And then the three that I will name is the most common ones. That's mild or early stage. And that's typically when a person begins to exhibit those concerns, having memory, language, personality, or some type of behavioral issues that they see that's happening intermittently, meaning one time it'll happen and then the next minute they'll say, oh, I remember. But eventually you'll see that it progresses to the second stage, which we call the moderate stage. And the moderate stage is that middle stage where typically an individual who is in that middle stage, that's where you see the behavioral changes. Individuals not remembering people's name, getting lost more often, forgetting where they place things. And that stage also lasts the longest. And then our second to last stage, I call it the third stage, and that is the late stage. And that's basically where you see people start to decline, and you'll see physical functioning issues occurring with that individual. This is where loved ones begin to think, should I place them in a facility, or how can I actually provide more care? Should I be with them 24 hours or provide 24-hour care? And then we do have, and we talk about this sometime, it's called the terminal stage. That's why I said it's typically five, sometimes three. That terminal is when we make a decision to have them go to hospice. So yes, there are different stages of the disease as well.
And how do you diagnose it? I mean, is there a blood test, X-rays? How will someone be diagnosed with Alzheimer's disease?
That's a good question. And we see and hear that in the clinical setting all the time. When, especially, where I am, a lot of older age people, and they always say, I want to get diagnosed with or find out if I have this form of Alzheimer's disease or dementia, if you will, or I want my husband or someone, and children will come in and say they want their parents. So, no, you do not find it in blood or urine. And I know people have said, well, I've gotten blood taken and they said I didn't have it. What they're doing is ruling out other things that may be going on with your body, like low thyroid or urinary tract infection. So they're trying to see if that's going on before they make that diagnosis. Oftentimes, what we do is we do an assessment. And that's when they're asking questions, a cognitive assessment. They may ask you a question or three words and then ask you to repeat those words. later on during that visit. They may ask you to draw a clock. There are different assessments that they will determine whether there is some memory loss or some concerns with you actually having some type of cognitive impairment. And then, of course, further on, if they decide that there may be, then they will run tests. They usually do a CAT scan that's similar to an X-ray, where they run put you through a machine and determine, looking at your brain cells, whether they are actually operating and active at that time. So there are various things that they do, and it's up to that provider to make the decision on what next steps they would take.
Dr. Allen, listen, this is good information, but I have to take a quick break. I want to continue our conversation regarding Alzheimer's. So let me take a quick break. To our listeners, please don't touch that dial. Don't leave us. We'll be right back on Informed Consent.
We will be right back after these important announcements.
Informed Consent.
Did you know that breast cancer is one of the most common types of cancers amongst women, and that 1 in 8 women will develop the disease in their lifetime? Currently in the United States, it is estimated that approximately 4 million women are living with breast cancer. In fact, health disparities in research studies have indicated that African American women are more likely to develop breast cancer under the age of 50, and they have a much higher mortality rate when compared to white women. In order to help prevent the complications associated with breast cancer, early detection and treatment is currently available. To learn more about breast cancer screening and the treatment options available, please speak with your primary healthcare provider. Your health is important, so schedule an appointment today. As a reminder, it takes a village working together to make a difference. This is a public service announcement. Hello everyone, this is Dr. Joe Morris, and I am the host of the radio podcast Informed Consent. Tune in weekly as I interview everyday people like you and me throughout the communities as they share their experiences and knowledge regarding health matters that will keep you informed and empowered. As always, it takes a village working together to make a difference. This is Informed Consent.
Welcome back to Informed Consent. I'm Dr. Joe Morris, and I am on the radio podcast Informed Consent. And we are here today with Dr. Angela Allen, and we are discussing Alzheimer's disease. So in the last portion of the interview, we kind of talked about, how Alzheimer's disease was formed or identified, and we talked a little bit about if it's contagious and some of the early signs regarding Alzheimer's disease, and even some of the stages of the disease. So I want to bring us back to this discussion regarding Alzheimer's disease with Dr. Allen. Dr. Allen, just give it to me straight, as we say, no chaser, just the facts. Is there a cure for the disease?
Unfortunately, Dr. Morris, there is not a cure for Alzheimer's disease and even most of the dementias that were shared earlier. So that's giving it to you straight. There isn't at this time, where scientists are still working on it.
That means that most of the care is based on treatment and maybe symptom management, I assume.
Yes, it is. When you mention symptom management, thank you for saying that, because when you meet one person who has Alzheimer's disease, you've met only that person, meaning the disease, even though it has a name, is individualized. And these people come to us with a past, and their past is often what they're functioning off of, because they're losing the memory of current things that are going on. And so when we talk about symptom management, we typically put a plan of care together for that individual and their family members. And we begin to look at what has worked in the past, similar situations, and we actually put those things in place with the individuals. I could tell you quickly, my grandmother had Alzheimer's disease, and what worked with her is the fact that she thought that I was her sister. So I began to actually interact with her as if I was her sister, but we were still able to get things done, as opposed to sharing with her that she could remember that I was her grandchild. So it's individualized treatment, and whatever works for that individual, of course, would be the process in which you're assisting that individual as well as their family caregivers.
So it sounds like they're both non-pharmacological or non-drug interventions, and there's also medication that one can take to help manage some of the symptoms.
Yes, there are 3 to 4 medications that are out there now that are actually been approved FDA. Other medications people have taken over the counter that has worked for them. But I have to emphasize those medications slow down the progression of the disease. It does not cure the individuals who may have the disease.
Wow. So really, if a person suspect they may have it or they are diagnosed, they really should follow up with their primary care provider to see which one of those medications works best for them. Is there any particular one you like the best?
Technically, I would say Aricept, and many people may be familiar with Aricept. Aricept is actually the one that we start individuals off, especially in the mild stage. And then also the other thing is Namenda, which is actually given during the moderate stage. But the reason why I said Aricept, because Aricept works all along throughout the stages until the decision of no longer taking the medication. So yes, so Aricept has been the most effective.
Dr. Allen, I want to dive a little bit deeper into this. From more of a cultural perspective, we know that different diseases have a different impact on different persons of color. And based on your understanding and research of Alzheimer's disease, are there any health disparities among minorities? And if so, what are they and how do we mitigate some of the challenges?
Well, it's interesting that, and quickly I'll share some of the disparities as we know. First and foremost, when you talk about the minorities, particularly African American and Hispanic, it has been noted, and a lot of my resources come from the Alzheimer's Association Facts and Figures 2021, the most recent document. uh, African Americans are 2 times as likely to have some form of Alzheimer's disease, particular or dementia, excuse me, particular Alzheimer's disease. Hispanics have been documented to have 1.5 times more, it been more than likely than their white counterparts to have this disease. And part of it is because of obviously the other things that may occur in their body, having more hypertension, diabetes, which also enhances or speed up the process of the dementia or some form of dementia, Alzheimer's disease. And then the other 2 major concerns that I would say is a delayed diagnosis or inadequate treatment for dementia, meaning that being in an environment where I'm a minority, and oftentimes my family said, "Oh no, grandmother's okay. She doesn't have to go get treated." What are you talking about? That's that delayed diagnosis or inadequate treatment where that provider says, "Oh no, she's just getting old. There's nothing wrong with her," but they did not truly assess them appropriately. So that's where that disparity issue comes in, and we have to address that. Be able to be aware of what's going on during that time. And as people
So,
of a healthcare setting, we need to be knowledgeable to inform family
yes.
members.
So how would you suggest that we not only increase awareness regarding the disorder in the
Mhm.
Black and Hispanic communities, but how do we get more people around the country just to, especially those people of color that it disproportionately impacts, how do we get them engaged and informed?
I like that. So first and foremost, we inform and educate the members in the community, and we have to be aware of who those people are in the community. I'm very involved with the African American community in my state. And so because I'm a known person that is involved in other areas, I begin to start sharing that information with them, particularly the African American community. There are events such as Juneteenth coming up. So have the literature there, provide the literature to the individuals, and also share with them that there's social media pages, and also and provide events and let them know upcoming events. Encourage them to have early detection and develop some type of plan of care in the community so that people will know where to go safely and confidentially, because I know that's a big issue with the African American Hispanic population. And then mobilize African Americans who are in the community, which basically I call them community connectors, to become aware and to participate in various programs and even in research studies so that they'll know what to do in these particular, groups of people.
This disease, it has such a burden, and it can put a burden on the family and the community. I know it's very expensive to care for someone with Alzheimer's disease. And as you mentioned, the trust factor.
Mhm.
And so not only is expensive, but also those other barriers there. And for those who may not have the resources or are unaware of what the resources are, um, care for someone, and if you're a family member and you are the primary care provider of that person with Alzheimer's, it does present a challenge, and it can be very burdensome with that. So I do welcome your comments and your information regarding, just being aware and increasing awareness around the country, because it does impact the African American and Hispanic community greatly. Dr. Allen, as we begin to kind of wrap this up, any final thoughts that you would like to provide to our listeners regarding this horrific disorder?
The final thought that I would say is just be aware of your family members, especially the older age population. Make sure that you're going to the doctor's office with them when they're getting checked up. And then also not be afraid to ask questions, especially to your providers or any of the family members that you may not have seen in a while. I think this is an excellent podcast, and I think this is an excellent topic, and I think we need to just be more aware.
Well, I definitely would like to invite you back again. I know there's another important topic to talk about regarding Alzheimer's, and that is the topic of caregivers and caregiver burden and such. And how do we best mitigate some of those stresses regarding caregiver burden? So if we can invite you back again to talk about that, that would be great. Are you okay with that?
Absolutely. I look forward to it.
Well, listen, folks, that's our time. I'm Dr. Joe Morris, and thank you, Dr. Allen, for coming on to the show. Dr. Allen, do I have your consent to release this information to the people?
Yes, you do.
There you have it, folks. Dr. Allen has given us her consent, and you have now been informed on informed consent. Listen, join us next time on the show as we continue to keep you updated on health matters that keep you informed and engaged. Until next time, I'm your host, Dr. Joe Morris, and remember, it takes a village working together to make a difference. This is Informed Consent.
Join us next time as we continue to explore topics that keep you informed and engaged on matters that promote healthy lifestyles.
Informed consent.